Over 36.9 million people are affected by HIV worldwide. This virus, which is responsible for AIDS, is so deadly that there's only one recorded case of a patient who has been functionally cured. AIDS has been around for almost half a century. So, why do we not have a sure-fix cure yet? Well, to understand that, let's dive into the specifics. We'll go over how HIV causes AIDS, the treatment that is available, and why the treatment may be ineffective. Like any other virus, HIV has a protein code and nucleic acid, in this case RNA. But it has this component that only retroviruses have called integrase. Integrase converts viral RNA into DNA, which is then incorporated into the infected cell's DNA to produce more virus cells. When viruses are done multiplying, they burst out, often killing the host cell. Not only does this make the virus spread faster, but this also weakens the body's immune system. See, the cell that HIV infects is T helper cell, which activates B cells to produce antibodies to fight off infections and T killer cells to kill infected cells. Hence, the body is left susceptible to opportunistic infections such as meningitis, pneumonia, cancers, and so on. Even something like common cold could put an infected person's life at risk. It is often these infections that end up taking the patient's life rather than HIV itself. HIV just weakens the immune system till AIDS eventually develops. Fortunately, we have been able to make some progress with antiretroviral treatment. This involves an inhibitor of integrase. This stops the viral RNA from being turned into DNA, hence the viral load in host cell DNA decreases over time and lies dormant. This also means that the chances of the virus being transmitted is also reduced. This, combined with antibiotics and disease-specific treatment against opportunistic infections, could increase the patient's life expectancy. There are also certain vaccines that people could take to reduce chances of HIV infection. However, this treatment isn't infallible. The viral load lies dormant, sure, but it can become active again within months or years. Moreover, HIV contains RNA, and RNA has a higher mutation rate than DNA. Retroviruses have higher mutation rates than usual RNA viruses. This means that the treatment would be ineffective when the virus eventually evolves. For the same reason, vaccines are also ineffective in the long run. Furthermore, the antibiotics against opportunistic infections could also be rendered useless if the bacteria become antibiotic resistant. It's like a mold that no longer fits the shapes available. Currently, the most reliable way to stay safe is prevention, which involves engaging in protective sex, careful use of needles, awareness about blood transfusion, and so on. As for infected individuals, following the preventive measures along with taking prescribed drugs regularly is vital for a remission or a functional cure. Advanced treatment has given us a shot at a comeback at a lost war. Hopefully, one day, further advancement can help us win the war.